In this section, we're going to look at the upper GI tract. The organs of the upper GI tract are those that are found superior to the diaphragm. The organs in the oral cavity, the pharynx, and the esophagus. In considering the upper GI tract, we're going to concentrate on the structures in these regions and how they influence the major functions of chewing and swallowing. When we ingest food and put it into our mouth, it's, of course, in sort of a solid, large state. And so first we need to start to mechanically digest the food by breaking into smaller pieces, as well as begin to mix it in with the liquid environment, namely the saliva that's secreted into our oral cavity. So chewing, of course, involves the teeth. This picture lays out the different teeth and how they're arranged in the adult mouth. Of course, when somebody is first born, they don't have teeth. The child's teeth grows in, which is a smaller set than what we see here. Those children's teeth are replaced with the adult set like we see here. To help move the food around within our mouth as we're chewing, we have the tongue. This picture shows a bit more than just the structure of the tongue. It's also showing tonsils that are arranged around the opening of the oral cavity. Besides the tongue that can move food around within our mouth to position it between our teeth, also the muscles of the cheek can help with that. The buccinator, when it contracts, helps to squeeze the food in so it stays between the teeth as we're chewing. This image shows the location of the salivary glands, which are outside of the oral cavity and secrete saliva into the oral cavity to mix with the food as it's being chewed, starting to liquefy the food. The parotid salivary gland is superficial to the muscles that move the mandible, located just anterior to the ear canal. And then the submandibular and sublingual glands are in the bottom of the jaw. The sublingual glands are more anterior and medial, submandibular more lateral and posterior within that space. The parotid duct goes to just next to the upper jaw, and the sublingual and submandibular ducts go to the area just beneath the tongue anteriorly. As I mentioned in the beginning of this section, the upper GI tract is the oral cavity, the pharynx, and the esophagus. The digestive tract crosses over the respiratory tract starting with the nasal cavity and the nasopharynx, the oropharynx and laryngopharynx, going into the larynx and the trachea. And you can also breathe through your oral cavity. The oropharynx and laryngopharynx are part of both the upper respiratory and upper GI tracts. The nasopharynx is only part of the respiratory tract. Epithelia that we see lining these structures reflect that. Strictly respiratory regions have pseudostratified epithelium, and the digestive tract has the stratified squamous epithelium, and the parts of the respiratory tract that cross over the digestive tract also have the stratified squamous epithelium. Setting off the esophagus from the other parts of the upper GI tract, there is a sphincter called the upper esophageal sphincter, which is just muscular tissue that can close off the esophagus when you're not swallowing food. It's a minor sphincter that doesn't get mentioned a whole lot. The lower esophageal sphincter is important, and we'll talk about that more when we get to talking about the stomach. That's also called the gastroesophageal sphincter, sometimes just leaving out the lower part completely, since the upper sphincter isn't terribly crucial, and not all sources even will refer to the upper esophageal sphincter. The process of swallowing is moving the food from the oral cavity down to the stomach and the abdominal cavity. There are basically two phases to swallowing. There's a conscious or voluntary portion. There is a voluntary portion where you move food around within your oral cavity when you're chewing, and you'll move it back using your tongue when you're ready to swallow. That will initiate the movement of the soft palate back to close off the nasopharynx so that food will go down the oro and laryngopharynx. That will initiate the involuntary aspects of swallowing, which are when constrictor muscles in the pharynx start to push the food down. The epiglottis will fold down to cover the lower respiratory tract to make sure that the food goes into the esophagus. The upper esophageal sphincter will be relaxed so food can move down there, and food moves into the esophagus. Once into the esophagus, swallowing follows a regular set of muscle contractions called peristalsis. Peristalsis is a type of propulsion through the digestive system. It doesn't only occur in the esophagus, but this is the first place we really see it and a great place to explain it. What happens is circular fibers behind the bolus of food that's being swallowed pinch in, and then longitudinal fibers along the length pull so that the tube shortens up a little bit, effectively forcing the food downward. Then this continues to happen as the circular fibers behind the bolus of food constrict in sequence, pushing the food down all the way. We'll see peristalsis other places. Sometimes it's modified a little bit or overlaid with some other muscular activity, but the esophagus and swallowing is sort of a pure form of peristalsis. In the next section, we're going to start to talk about the lower GI tract, and we'll start with the stomach as a separate part. Now, part of this is because under some definitions, the stomach can be considered part of the upper GI tract also, especially from a clinical perspective. When an upper GI endoscopy is being done, a camera is inserted through the oral cavity and goes down the esophagus, can view the stomach. So an upper GI test includes the stomach, but anatomically, the stomach belongs to the lower GI tract, and we'll get into that starting in the next section. Consider this question. When you feel that you've reached an answer, hit the next button to go into the next slide, which will reveal the correct answer. In swallowing, food moves from the oral cavity down to the abdominal cavity, namely the stomach, through mostly the process of peristalsis. Now, these other terms here will come across in other parts of the digestive tract, and they have a peristaltic aspect to them, but they're not purely peristalsis, and that's what's happening in the esophagus during swallowing.